Sick of something other than COVID-19 or the flu? Here's what it could be. The flu season is coming to an end, and weekly COVID-19 diagnoses are decreasing. However, if you are now suffering from a respiratory infection, you are not alone. According to the Centers for Disease Control and Prevention, CDC, a variety of respiratory viruses are now circulating, including common coronaviruses, other than SARS-CoV-2, which causes COVID-19, respiratory adenoviruses, and parainfluenza, which is not the same as influenza. It's very, very hard to tell the difference between any of them clinically, says Dr. Helen Chu, an associate professor of infectious disease at the University of Washington and a principal investigator at the Seattle Flu Alliance, which tracks respiratory disease spread. Norovirus and rotavirus are also present at the moment, but they produce gastrointestinal symptoms such as vomiting and diarrhea. While several viruses are now spreading, one respiratory virus is causing an unusually high percentage of positive test results among those reported by the CDC, human metapneumovirus, HMPV. According to CDC data, more than 20% of antigen and 10% of PCR tests voluntarily reported to the agency by U.S. laboratories during the week of March 11 were positive. It is important to note that this is expected respiratory activity for these viruses at this time of year, a CDC representative told Time, adding that the agency is also monitoring adenovirus and parainfluenza outbreaks. Dr. John Williams, chief of infectious diseases at UPMC Children's Hospital of Pittsburgh and a longtime HMPV researcher, thinks that an increase in HMPV is not surprising. According to him, the peak season for HMPV in North America is often February through May, a little after the flu season. This season, we saw an above-normal surge of RSV and an above-normal surge of flu, according to Williams. Knowing the seasonality of metapneumovirus, I speculated, I bet we'll see a similar increase of metapneumovirus. And, indeed, we are. Many people have probably had HMPV without realizing it because it causes common cold symptoms like coughing, fever, and nasal congestion. According to the CDC, in severe cases, which are most common in young children, the elderly, and immunocompromised individuals, HMPV can cause consequences such as bronchitis and pneumonia. Some people experience shortness of breath as well. Dr. Ann Falsey, a professor of medicine at the University of Rochester School of Medicine, says it's tough to determine whether this year's HMPV season is worse than usual because we test a lot more now. After 3 years of the pandemic, people are very sensitive to getting a swab. Despite this, Williams believes that many HMPV instances go unnoticed. When clinicians examine a patient with a respiratory ailment, they frequently test for SARS-CoV-2, influenza, or RSV. Some tests can detect HMPV, but they are expensive and are used infrequently. According to Falsey, researchers will not completely grasp how widely viruses like HMPV propagate unless they conduct more extensive testing. And, she argues, if doctors don't know why a patient is sick, they may prescribe medicines unnecessarily, which can contribute to antibiotic resistance. However, Chu believes that patients do not necessarily need to know the precise nature of their illness. Chu believes that testing for SARS-CoV-2 and influenza is important because those illnesses have therapies. Screening for RSV makes sense because it can cause serious sickness, particularly in young children. If such viruses are ruled out, Chu says there's usually no need to test further because HMPV and many of the other respiratory viruses that circulate throughout a typical cold and flu season don't have specific therapies.